public health and prevention theme that's led by myself and Phil. And we also have a workshop with the workforce theme later to discuss some of those issues around employment and health. Take away, Phil.
Thank you very much. Is that working? Yeah, it sounds like it is. It's good that I've got a timer because I'm terrible at keeping time. So, first slide. So, welcome. I'm Phil McKell. I'm the co-lead with Ben for public health and prevention. So, if you go to the next slide, please. So, our priorities are healthy places, trying to look at evidence base around commercial and physical environments, household health resources, which is developing a whole system poverty-proof approach with a particular focus on families and children. And then finally, maximising equitable uptakes of preventative interventions, which is going to involve developing new modelling techniques that will help us identify people at risk and also inform, develop and test new prevention approaches and interventions. So if we go to the next slide, please. So we have a set of objectives. In the short term, we want to continue our work evaluating interventions, and we also want to create communities of practice and research interaction networks, which are going to be with our key stakeholders. And then in the medium term, we want to develop modelling techniques that will help us better identify the unmet need in our population. And we want to work with those stakeholders to co-develop and evaluate tools for system change. And then finally, long term, we want to establish whole system change and focus on a whole system poverty mitigation approach. Next slide. So that is people, we're all in the room today, and we want to also create working with the Northwest Coast HDRCs and Public Health Research Collaborative. Next slide. So our progress, I've got a list of projects there, and we're going to focus on, for healthy places, we're going to submit an application for pride of place. For household health resources, we have a number of projects, but the main one we're going to focus on is Liverpool Economic Activity Framework and the current proposal for the What Works Centre for Employment Support. And then finally, we want to maximise the uptake by focusing on things like health checks and perinatal health, and we have a set of collaborations. Next slide. I've run out of time, so I'll finish, but essentially that's a list of what we're going to do next. Cheers.